How do you find dealing with demanding patient cases, things like plab 2, RCA, CSA, OSCEs, for example? When you get that patient who just demands something non-stop in your role play or your consultation, let me talk about one simple thing that can really help you find some more time in that case or find a little bit of space to do the things that you want to do. Let's set the scene. You guys are doing a situation and a patient wants something that may or may not be reasonable, but they just keep mentioning it. For example, they might want some antibiotics, they might want a referral, they might want admission, they might want a particular test, for example, CT, MRI, something like that. But someone is just pushing you and pushing you and pushing you for something, and you find it hard to find space to ask things like red flags or psychosocial or ICE or the other, the 3 Arora bubbles that we always talk about in these types of videos. How can you find some space? I'm Arora. I teach a lot of people for things like plab 2 and RCA and many other exams that involve role plays or consultations, and the demanding patient scenario is one of the most challenging ones. Now, one thing that we talk a lot about is almost mentioning the demand more than the other person. Why do you think, for example, somebody mentions CT head again and again and again? They've come in and told you, doctor, I want a CT scan on my brain, or doctor, I've got tonsillitis, I know I have, and I want some antibiotics. Sometimes you start doing your data gathering or your history taking, and you find that every time you try and do some questions, they bring it back to the demand. Yeah, but doctor, that's great, but am I going to get a CT scan or not? Yeah, doctor, that's great, but can I just have the antibiotics? Yeah, doctor, I've answered all the things in the past. Can I just get that scan? Why are you making it difficult? Why are they constantly coming back to the demand and therefore taking up the majority of what you think is your data gathering? It's because sometimes you haven't acknowledged the need for the demand, and sometimes that's an important thing to do. We talk a lot about acknowledging things, but one thing that's really useful to think about is trying to mention the demand more than they do it. The more you mention the demand yourself in that role play or consultation, the less they need to keep on mentioning that demand, the less they feel that they need to bring you back to what they want. So for example, say someone wants, I don't know, a CT scan, for example, then you should be mentioning the word CT scan as many times as you can in that role play to almost make it mean that they don't need to do that, and therefore they don't need to interrupt what you're doing. So for example, if you go into your red flags, bring it in. Mrs. X, when people ask for CT scans, there are a couple of yes/no questions, medical questions we'd like to ask. Just going to run through a few if that's okay. When it comes around to psychosocial, maybe they're demanding a CT scan because they're getting headaches. Bring the CT scan back. Mrs. X, when people request CT scans for headaches, then we look for things in their lifestyle that may be making a difference. Can I run through a few things about you and your lifestyle? But keep mentioning the demand more than they do. When you go into ICE, for example, Mrs. X, when people come asking for CT scans, there are often lots of thoughts or worries going through their mind. Can I find out a bit about what you may be thinking? Again, mention the CT scan more than they do. If you need to ask about, I don't know, drug history, mention it. Mrs. X, you mentioned a couple of medications, but the pain is clearly so bad that you want a CT scan. So can I ask what medications you may have tried over the counter, tried yourself, etc. See, the more you mention the word CT scan, the less the need is for the other person to keep mentioning CT scan, and the more space you're probably going to get to do a decent data gathering. Remember, it's all about understanding issues when you do a data gathering, but it's very hard to get the questions out to find these issues if you don't acknowledge the demand, and go a step further if you don't mention it more than the person feels they need to mention it. Same with antibiotics. Someone's demanding antibiotics. Mention antibiotics as many times as you can. Mrs. X, when people ask for antibiotics for a throat infection, there are a couple of medical questions, yes, no questions we'd like to ask. Just going to run a few through if that's okay. Mrs. X, when people think about antibiotics, then lots of things may go through their mind. Can I just find out, is there anything you're thinking this may be, or anything particularly worrying you, for example? Again, mention the word antibiotics multiple times. You'll find that the person on the other side doesn't feel the need to keep doing it, therefore the demand almost gets less, and therefore you buy yourself a bit more time to ask those questions that you need to ask to be able to answer the question later on. So whether or not you think that this person does need what they're demanding, because they could well need it, they may not need it, but whether or that's the case, at this stage you don't know, because you haven't done a solid data gathering, and sometimes we don't have the space to do a solid data gathering because they keep mentioning the demand, and that's why these cases and consultations and role plays are particularly challenging. So if you are preparing for plab 2 or RCA or CSA or anything else that involves role plays and consultations, and you struggle with those demanding patient scenarios, then try this really simple technique, okay? Try and mention the demand more than the other person feels they need to, and you'll find you can probably control that data gathering or history taking a little bit better, and therefore get more high value questions in, and therefore having a much easier conversation in the second half when you start to discuss things like pros and cons, or when you need to say that, no, actually, I don't think that you need this particular demand of yours. Now, there are lots of other things that we have on the YouTube channel in terms of dealing with challenging patient scenarios, whether it's angry patient, embarrassed patient, a patient who's upset, fearful. So worth going through, having a look at some of those videos, and do subscribe if you find the channel or this video of some use. Please do share the video to people that you think may find this of value. If you want any of our courses, please don't forget to use the coupon Arora Video 10, ARORAVIDEO10 for 10% off any course, whether it's plab 2, RCA, medical school, AKT, MSRA, plab 1. We have a whole bunch of stuff, whether it's our live courses, online courses, mock exams, flashcards, audiobooks, or our all-in-one gold package. But next time you're practicing a role play and you get that demanding scenario, just remember this one key thing. Try and mention the demand more than the person feels they need to, and you'll find the role play hopefully goes a lot more smoothly, and you're able to talk about many more things in the second half. I really hope this helps. You know, the hashtag Campus Will Pass, hashtag I went with Arora. Have a super day.